Early PT reduces length of hospital stay and care needs in frail, older inpatients, an observational study, presented by Corbin May, Jordan Taylor, Andrew Lambert, Kyle Graham, and Josh Ergel.
Background and purpose. It is well known as people age and become frail, it is harder for those individuals to recover from illnesses, falls, or adverse events, which lead to longer stays in the hospital and sometimes physical deconditioning and loss of function. Over recent decades, medical and technological advances have allowed the life expectancy of men and women to increase. In a recent study in 2016, researchers found that higher PT frequency is associated with shorter length of stay and greater functional recovery. This study showed the more physical therapy an individual received during hospitalization resulted in shorter length of stay and greater functional recovery. However, it did not look at how soon the individual was first assessed by a physical therapist. This study hypothesized that a PT assessment within 24 hours of intake would reduce length of stay through optimization of physical functioning and may reduce the need for care upon discharge.
This was a retrospective study, so they went back in time to analyze all patients that were admitted to the Department of Medicine for the elderly from May to August, excluding those that weren't examined by a PT. All data came from the hospital electronic medical record, and patients were split into two exposure groups: an early PT assessment, which was within 24 hours, or a late assessment, which was after 24 hours. The outcome variables they looked at included length of stay, the elderly mobility scale, walking speed, and the need to be placed in an institution at discharge. The elderly mobility scale assessed balance, mobility, and the ability to change positions. This was on a 20-point scale, with 0 being the worst and 20 being the best. Age and gender, the existence of a formal care package, number of falls in the last year, and specific comorbidities were also collected at admission. All this data was analyzed using the IBM SPSS statistics software with a level of statistical significance set at p is less than 0.05.
During the study period, 1,022 hospital episodes of care occurred. Of those, 19 were discharged prior to seeing a physical therapist and were therefore excluded from the study, bringing the total number of cases analyzed to 1,003 episodes of care. 584, or 58.2% of the total episodes of care, were examined within 24 hours and were placed in the early assessment group. 419, or 41.8% of the total episodes of care, were examined after 24 hours and were placed in the late assessment group. At baseline, several comorbidities were compared between the two groups. The only comorbidities that were significant at baseline between the groups were myocardial infarction, congestive heart failure, metastatic cancer, and depression. The early assessment group length of stay ranged from 3.1 to 13.7 days. The median interquartile range was 6.7 days compared to the late assessment group, who had a length of stay range from 4.2 to 20.1 days, with a median interquartile range of 10 days. The number of patients who required a new package of care were 110, or 20.3% of patients in the early assessment group, and 105, or 27%, in the late assessment group. Additionally, there was a trend observed in the early assessment group being less likely to require a new institutionalization on discharge, with a p-value close to being significant at 0.073. In this study, the authors used what is known as the hazard ratio. The hazard ratio for this study represents the likelihood of being discharged back to the patient's usual residence within 21 days of admission. The hazard ratio comparing the early assessment group to the late assessment group was 1.29, with the confidence interval of 1.12 to 1.48, meaning there's a 29% increase in the probability of discharge to the patient's previous place of residence for the patients in the early assessment group compared to the late assessment group.
In conclusion, elderly adults requiring inpatient hospitalization are at an increased risk for functional losses due to lack of physical activity during their stay. Physical therapy can play a huge role in the factors associated with these inpatient stays. As our results showed, early physical therapy assessment was associated with a shorter length of stay, reduced need for care post-discharge, reduced new institutionalization in the near future, and at minimum equal amounts of functional recovery at discharge. This may be due to a lack of deconditioning as a direct result from the physical therapy interventions, patient education, and improved patient confidence in self-administered exercises. As this study was a retrospective study, a prospective randomized clinical trial should be done to confirm causality between the early physical therapy assessment group and the benefits listed above. It's also important to note that the late physical therapy assessment group had some more comorbidities than the early physical therapy assessment group. So in the future, if there's a study done, they should also try to keep those more equal at baseline. As far as clinical application, results from this study demonstrated the importance of incorporating physical therapy as early as possible in an elderly patient's acute care stay. This can be done in many ways, but 2 ways are to incorporate physical therapy as part of the initial patient evaluation upon admittance and for further evidence and advocacy for physical therapy in these settings. The study suggested that physical therapy is used in the comprehensive geriatric assessment and that patients that receive this assessment at the Department of Medicine for the Elderly have better hospital outcomes. Therefore, if you incorporate these findings into practice for hospitals and other inpatient facilities, and they have physical therapists as part of that initial evaluation, we should also see better hospital outcomes, just as the study suggested. The other way for PTs to be used sooner in this setting is for physical therapists to continue to show their value to the facilities through further research on functional outcomes and healthcare savings from reduced length of stays. The more evidence provided to back physical therapy, the more likely facilities are to make physical therapy an early priority in patient care.
Here's a list of our included references. If you have any questions or if you would like to find out more about our topic, please feel free to comment below or contact us. I hope you enjoyed our presentation and have a great day.